My name is Soraya Chanyasubkit, and I specialize in family medicine, and I work at Virginia Mason Edmonds Clinic. I chose family medicine. I'm sure many doctors have said this, is they love taking care of everyone. I specialize in families, so that means I love taking care of babies, prenatal patients. I love taking care of grandparents or just older adults with young hearts and kind of everything in between. I treat many disease states, but in addition to treating disease, I think with family medicine, promoting health and wellness is also a key aspect of family medicine. So helping people achieve their goals. I am a family med doctor, specifically one of the family medicine doctors who delivers babies. So obstetrics is a big part of my practice. And I love taking care of pregnant moms or even women who want to be pregnant and just want some extra guidance with that. And women who know that they definitely don't want to be pregnant. And I love doing contraception management. I love taking care of little babies and having that continued presence in a woman's life and a woman's health is really rewarding to me and something I really enjoy. What I love most about family medicine is the family aspect of it and the people aspect of it, both from the staff that I work with, but also the patients I have the privilege of caring for. It's so rewarding to have a pregnant lady that I see during the pregnancy. And then near the end of the pregnancy, she asks, like, who can see my baby? And I say, I can. I've seen you. I know your health. And having her know that there's continuity within her care and her baby's care is wonderful. Definitely all the time. The resilience in our patients is very commendable, and sometimes the patients necessarily don't start off strong because there's a lot of emotions with a new diagnosis or a change in their health status, but seeing them accept things or work to change things, whether it's losing weight, whether it's tackling a mental health issue, and them overcoming things or them working or changing themselves or changing their surroundings to better themselves is always it's always dynamic. If we imagine healthcare, sometimes they put the doctor or medical home right in the center rather than the individual and the patient. And I say that obviously the patient is smack stab in the middle because everything is kind of circling around the patient. And honestly, the next circle outside of the patient is not even the medical system yet, but their family and their community, because that impacts all aspects of that care. And then around that, it's the medical healthcare system and how we can support them. So in my mind, honestly, the patient isn't the top of the pyramid. It's rather like the center of multiple circles. I like to know my patients outside of solely their diagnoses. I think that's very important. So getting to know them, whether what their relations are to the community, if they have grandchildren, if they're a director or of some organization or their job, because that also provides me information about what their day-to-day life is, what their responsibilities are, what their priorities are. And that way I can work with them to better help them solve whatever medical issue they have or whatever concern they would like to address. Because giving them, for example, giving them a medication or a suggestion without knowing who they are, likely they're not going to take it. But if we are able to work together to solve whatever we need to solve or work on whatever we need to work on, then I feel there's a better alliance there than just a one-way relationship. I specifically came to Edmonds Family Medicine and Virginia Mason because I enjoy family medicine with obstetrics, and that was a huge pull. And just the community, both in terms of the people that I've met here and just the surroundings, have been wonderful and so supportive. And patients who are also new to me, who know that I'm new to the state, have been so welcoming, giving me advice about where I should go hiking or where I should go eat, and just having that supportive both the supportive staff and supportive patients have been a huge boon. To make each relationship special, again, is noting who the patient is outside of the clinic, because we might see someone for only 15, 20 minutes, but they live a whole lifetime outside, and knowing what their priorities are, what's important to them, and engaging them. I think that's a key thing, having patient engagement and that back and forth to make sure that we are taking care of you, and and what's important to you is also important to us. One of the draws to the Pacific Northwest was definitely hiking. I am not a speedy hiker, but I would say I'm a consistent hiker. I love walking. I love the sights and sounds of this area. I enjoy reading. I love cooking. I love walking. And those are what keep me busy outside of the clinic.